Joining us now, Democratic Congresswoman Sharice Daivds of Kansas, a state that has a big role in this debate. And Congresswoman, it feels like things are getting worse, not better. So what we're seeing is a big political loser for Republicans, not in step with where most of the country is on this. But yet we're waiting to see whether mifepristone is going to be taken off the market.
Yeah, and I think, this is, well, first of all, good morning. I'm glad we're talking about this because of how important it is. And, I think exactly what you're saying about the political consequences is absolutely true. And I also think, this is... the last time I was on here, I think we were talking about how scared people were and how we were already seeing lives being upended because of the consequence of Roe being overturned. And we would think that knowing so many people disagree with taking these extreme steps toward, frankly, inserting politicians into very private decisions would have been quashed because of the last election. In Kansas, we fought really hard to push back on a constitutional amendment that would have opened the doors to some of these extreme measures. And then in November, we saw people push back against politicians who are taking extreme stances on this as well. So I do think that we're hearing loudly and clearly that what folks want are their rights to be protected. They don't want their kids to have less rights than they did. And it's actually mind-boggling to see steps like this.
Yeah, so tell us what we can learn from Kansas, or what those who want to protect the health of women can learn from Kansas in terms of getting people to the voting booth and really making change happen.
Yeah, well, first of all, I think it's been very impressive to see how many people are making their voices heard, not just at the ballot box, but in every aspect of in every aspect of our society. And the second thing I would say is recognizing that this, what we're talking about right now is not just the threat and real danger of access to reproductive health care being on the table because of one judge who, frankly, wrote an opinion that even conservative pundits and judges have said is lacking in science. And I think that that's one piece of it. The other piece is that we absolutely need to make sure that the FDA is able to continue to do the work that it does, approving medications that, frankly, will save people's lives. And I think that folks should make sure to let their lawmakers know, both at the state and federal level, because this is we're talking about a federal case right now, but these things are happening all over our state, all over the country. Kansas is absolutely right at the center of that.
It certainly is, Congresswoman, and I was going to ask you about that, because the vote in your state on the proposed constitutional amendment that would say there was no right to an abortion in your state that took place last August was seen as one of the first post-Roe decision tests. Where is the country on this? And by almost 20 points, the people of Kansas voted to protect the right to abortion. And that's in a state that hasn't voted for a Democrat for president since Lyndon Johnson. So what did that vote tell you, and what should it say about the way people are feeling in the rest of the country on this issue?
Yeah, I mean, I think what it tells me is that people are feeling the impacts of this. In Kansas, what we're seeing is our neighboring states had recently either enacted or brought back old laws after Roe was overturned, and then this attempt to take what I would consider to be an extreme step, trying to change the state constitution. I think that my hope is that people will see, what folks want are lawmakers who are actually trying to make things better. People in Kansas are still trying to figure out our small businesses are dealing with supply chain issues. Our farmers are dealing with droughts or flooding and want to make sure that we get a farm bill done. And instead of having as much bandwidth to focus on those things, we've got politicians who, frankly, in D.C. are not only threatening access to the full range of reproductive health care, they're also, you know, focusing on things that are not going to bring down costs for people, you know, and I think that I think what every single person who's in Congress right now should be learning from what we saw over this last year is folks want us to do our jobs and make sure that their government is working for them.